This is Samantha. She's gonna be the dummy as I show you what a chiropractic adjustment feels like. At Muscle and Joint Chiropractic, we try and make the adjustment as gentle as possible while still getting a nice adjustment or pop, some people would call it. The important thing is that we get improved range of motion after the adjustment. So I'm gonna have you look to the left and then look to the right. So we're gonna adjust Samantha to the right first. As I move her neck, I just get to a nice comfortable position, and then the adjustment is just a quick little movement. I'm not cranking on her neck or anything like that, and then we usually hear a nice pop. So just relax, Samantha. Okay, deep breath in, and out. And then we're gonna do one more adjustment this way, relax. Just let that head fall. And then deep breath in, and out. Is that all right? Okay. And then we're gonna do an adjustment on our hips. So what I'm gonna do is just pull on her hips. Does that feel okay underneath? Okay, so I'm gonna do a little tug. So just relax. Is that okay? And then same thing on the other side. Relax. And then we're gonna do an adjustment on her mid-back. Now when I adjust the mid-back, I try and let the patient's body weight do the adjusting so I don't have to use a lot of force. Just cross your arms. Take a deep breath in. Oh, stay on your back, face up. And then deep breath in, and out. Is that all right? And then again, breath in, and out. And again, and out. Okay, so let's have you go on your side and face moves. Like this, look up at the ceiling. Let this head drop. Deep breath in. And out. And then on your side, face that way. Relax this, relax. Look up at the ceiling for me. And then deep breath in. And out. And then going back, face up. And then we can adjust the ankles, the elbows, the wrists, whatever just needs to be adjusted, we're able to do. Sometimes we'll do a little traction adjustment on the neck if it's needed for the patient. But that's what a general adjustment looks like. Some people that don't like to be popped or cracked, we have the table will actually lift up and drop. It's called drop table to do the adjustment. And then we have a device that's called an activator that we can get tricky spots, and if someone likes a really gentle adjustment, we can use that. The important thing is that they're moving better and they're in less pain after the adjustment.